Welcome to Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello and welcome to All Home Care Matters. Today we're going to talk and discuss senior living options. This is an option that can be somewhat overwhelming and confusing for families and their loved ones when they start to explore possibly moving into one of the facilities and often have preconceived notions about what they are and what they provide. Now, there can be several reasons for an older adult or their family to begin exploring the option of senior living, and that can vary. Some older adults, they may decide it's time to downsize at this stage in their lives, and the maintenance of their home just becomes too much and more difficult to keep up with. Or maybe it's for financial reasons, or it could simply be they're looking for more socializing and activities. So it's usually at this stage, the family may begin looking at if senior living is the right choice for them and their loved ones and their needs. First, though, let's talk about independent living. Independent living is designed more for older adults who are fairly healthy and independent, as the name implies. This option is meant for independent and active lifestyles. And sometimes, again, they're looking for that socializing activities with peers of the same age group, which separates it from a typical apartment or condo-style community. The living spaces and rooms are similar to an apartment or a condo. There's the option of communal dining, or if the senior chooses to host a dinner with family or friends in their own apartment if they prefer. Now, why is it that we're seeing more and more facilities and communities being built? The rise in baby boomers and the need for more senior living has created this large boom, if you will, in the development of these various senior living facilities and communities. Now, with that said, I've even seen and noticed that some are reshaping what they're offering and what they provide for residents that typically in the past you may not have seen. So one of the reasons is there's so much competition out there in senior living right now that these facilities are trying to offer more and more options for seniors and for people looking to downsize and be within a senior living community. Now, independent living, like we said, offers very little, almost no assistance with care. And again, as the name implies, it's for independent seniors and those looking to downsize and really have more activities and socializing with people in the same age group as them. Now, what's the average cost of an independent living community? So, with that being said, the average cost varies depending on where you live at and even down to what city you live in. But we're going to compare states for this report. The average cost of an independent living varies, again, depending on the state you live in. For instance, we're here in Michigan. So the average cost in Michigan, monthly average, is around $2,190. The monthly minimum is around $2,049, and the monthly maximum can go all the way up to around $4,450. Now let's compare these figures to the state of Massachusetts, which has the highest averages. Massachusetts' monthly average is around $4,002, almost as high as Michigan's monthly maximum. Now, Massachusetts' monthly minimum is around $3,200. And Massachusetts' monthly maximum is a staggering $6,800. So you can see a lot depends on where you live at. South Dakota, for instance, had the lowest monthly average of around $1,399. Now, if you want to learn more about independent living options and information, visit seniorliving.org. It's a great source for families, and we used a portion of the data from their website for this statistics and financial reporting. We also use seniorhomes.com for some of the financial figures and data as well. Really, the main thing to remember when it comes to independent living is that these communities as a whole are always evolving, changing, and adding more options to make them as attractive and appealing, not only for the seniors and residents, but also to outdo their competitors. Now, another popular option when you start to see you may need a little more assistance and care would be assisted living. As we were just discussing about independent living and how they are styled towards a more independent, mobile, and older adult, we'll look and discuss assisted living. These communities offer private and semi private personal living areas that are typically apartment style rooms, much like independent living are. However, as the needs grow for individuals, they may require more than what would be provided in an independent living environment. This is one of the things that helps differentiate assisted living from independent living. Assisted living has staff available 24 hours a day, 7 days a week to assist residents with their ADLs or their activities of daily living. Now, the assistance could be as little as helping a resident to get dressed, toileting assistance, helping to schedule doctor appointments, grooming, and transportation to and from appointments. Now, there can be additional care and assistance provided, and make sure to ask the facilities about the cost because most often your a la carte services in assisted living outside of the room and board or 1 or 2 meals a day cost additional to that room and board. An important thing to mention regarding transportation and care, this does not mean that the resident would have a caregiver with them 24 hours a day, 7 days a week, or even with transportation assistance, that they would be going in a car or a van by themselves. Typically, what happens in your assisted living facilities and communities, they take groups of residents out and can, when possible, schedule several appointments and errands all on the same day as to minimize the transportation. Now, some of the reasons that this is done in this way is because of staffing and vehicles that are available. This is mentioned because quite often we have questions from families inquiring about these very things. We had a family recently who was left with the impression that the assisted living facility would be able to sit with their mother for a couple of hours every evening to help her go to sleep, and the family had wanted them to take her mom for drives or on outings when she'd become upset or agitated, and this was because she missed her home and suffering from some mild dementia. She didn't understand where she was at quite often because she had lived in this home for many, many years, and they decided that it was time and it would have been safer for her to be in a facility. So when the mom would get agitated, it helped her to become more relaxed. And the facility could not provide that coverage or that transportation and advised the family that it sounded like they needed home care services if those things were needed and help their mother. So they ended up hiring our company, and we would visit with their mother 3 times a week to help with those needs. What happens when your loved one requires more care than the assisted living is able to provide? And that's exactly what situation they found themselves in. And this is a question I would recommend every family to ask when visiting or looking into assisted living. Some assisted living facilities have dedicated wings in them where if the resident requires too much one-on-one care and attention, they will offer that as a suggestion for the family. And typically, these are memory care wings that are more in line with a nursing home style environment. And often, the options they will present, especially if they do not have these dedicated wings or the increase in care needs are not related to dementia or Alzheimer's, is they recommend hiring professional home care companies. And the professional home care company would come in and provide care for the family. This option is nice because it is flexible for the family. If your loved one does not need to go into a memory care facility and maybe just needs a little extra help in the evenings or the mornings or really whenever it is, or just on certain days, the home care company can come whenever the family needs that extra support and for as long as they need it. This option also allows their loved one to continue living in their familiar surroundings, whether it's the assisted living, the independent living, or their own private home. And that way, they don't have to leave that familiar surrounding. Like this particular family, their mother had been in the home for 40, 50 years. And the family decided it was time for them to sell the home and downsize for mom and move her into an enclosed, safe environment like this assisted living. But what they did not realize, and most oftentimes families don't realize, is once you take a person, especially somebody suffering from a form of dementia, out of those familiar surroundings, it can take them weeks or even months to reacclimate to a new surrounding. And oftentimes you'll see an increase in the agitation, confusion, and irritability in their behavior and in their health while they are reacclimating. So the family was wanting her to have some extra support and comfort, but the family didn't realize, and they told us, they said, we thought when they said assisted living and 24-hour care available, they thought that meant that the staff would be able to be with their mom whenever and for however long she needed. And it wasn't until these situations started to arise that they realized that wasn't the case. The staff was great and they were supportive, but they could not accommodate these specific needs that the family wanted for their mother. So, assisted living can be paid for through long term care, insurance, veterans, aid and attendance, and private pay. But remember, find out what exactly they can provide for you as far as support services, how extensive the one on one care is that they can provide, and then what the options are if your loved one or even yourself starts to see a big increase in their care needs. Oftentimes, they will either recommend, like we said, going into a long term care wing of their facility, or they will recommend bringing in outside professional support services, or finally, you will be asked to make new accommodations that they can no longer provide for the care needs of you or your loved ones. So we just like families to go in as educated as possible, knowing exactly what is and what is not provided and some of the questions they need to ask. As we mentioned, with independent living, it is very important to do your homework when researching assisted living. They're not all the same, and they all typically provide a dining room, activities, day trips, outings, and private and semi-private room, and 24/7 health professionals. However, the cost and qualifications to apply and move into one is wide-ranging. Again, just like with independent living, we're going to use Michigan as the average here. The average cost of assisted living in Michigan is around $3,250 a month. And this figure is around $500 more a month than the national average of $2,877 a month. And this again is from seniorhomes.com. And since we used Massachusetts for our comparison with independent living, we're going to use it again here with assisted living. The average cost of assisted living in Massachusetts is around $5,300 a month and is almost, but not quite double the national average of $2,877. Even though these figures show the average for the respective states and nation and the nation's average, it doesn't give the full picture. In Michigan, the average cost of assisted living can vary pretty wildly based on the county or city that you live in. For instance, in Ann Arbor, Michigan, the average cost monthly for assisted living is around $5,201, almost the average cost of Massachusetts. Now, in Monroe, Michigan, the average cost is around $4,861. In Midland, Michigan, the average monthly cost is around $4,841. And in the Lansing, East Lansing area, the average monthly cost for assisted living is around $4,635. In Kalamazoo and Benton Harbor, the average monthly cost is around $4,468. So we can see just by these examples that the state averages can vary quite a bit when looking more closely at the specific cities and areas families may be looking for the assisted living in. Another factor to ask about and for you to be aware of is that a lot of the assisted living and independent living communities and facilities also have financial requirements as well. This means they're going to look at a person's wealth, income, and assets to ensure that they meet certain criteria for their respective communities and facilities. Now, each community or facility will have their own specific requirements that will need to be met. And also, something worth talking about is the requirements and options provided can vary. When going through the initial consultation, it's really important to make sure that you ask about the options they provide if and when the time comes that you or your loved one begin requiring more care, as we discussed. This is an important issue, as we said. Different facilities will offer different services. We recently had another family who had sold their mother's home and decided it was time to downsize, and they met with a sales consultant from one of the local assisted living communities in their area, and they set up a time to meet with their mother. At the time, their mother was actually in the hospital recovering from a serious fall that she had taken. After meeting with their mother, the consultant felt she was an ideal candidate for their facility, but once they moved their mother in, keeping in mind she was just discharged from a long hospitalization, she went into a deep depression and became very reclusive. The family had called us and asked us to set up a time to talk, and so a day or so later we met with them, and their daughter explained that for the past several weeks, her mother wouldn't even leave her room and had several falls and noticed her memory loss had become more magnified. The daughter explained that she asked the facility to see if they could match or pair her mother with another resident to help try and warm her up to the facility, or even have one of the activity aides come to her room and try to bring her down to their activities. Unfortunately, and this is understandable, the facility told the daughter that they did not have enough staff to go to each resident's room and spend time trying to bring the residents down to the activity room. And they would ask around, and if one of the residents would not mind trying to buddy up with her mother, and nobody really seemed interested. The daughter was understandably disappointed as well and was trying to find the best way to help her mother adjust. And as I said, she had just reached out to us to discuss her mother and what they were going through. In the meantime, just before she came to meet with us at the offices, she received a letter from the facility that said upon further review, her mother was no longer meeting the criteria to be a resident at their assisted living community due to her having repeated falls, and that the family was offered two choices. In the next 30 days, their mother would have to move out, or they would have to hire an outside home care company to take over all of their mother's care and needs, releasing the assisted living facility of all of the liability. This really upset the daughter, and she was confused, frustrated, and sad by this. The daughter explained to us that all of her mother's needs and abilities were discussed and gone over extensively when they initially met with the sales consultant when her mother was still in the hospital from her fall she had had. In the end, our company was caring for her mother at the assisted living facility 24 hours a day, 7 days a week. On top of that, they were paying the facility their monthly fee. Now, this had gone on for quite some time, and the daughter and her family made arrangements for her mother to move, and they had found her a very nice one-bedroom apartment for a fraction of the cost they were paying the assisted living facility. Now, the reason a professional company had to be brought in was because this particular assisted living community did not offer care services, meaning when a resident requires more care than just the average shower service or medication reminder or wheelchair assistance, some of these facilities do have in-house contracted home care companies that they use staff for this very purpose, but a lot of them do not have that service. So they did offer a shower and bathing service and medication reminders and a facility van to take residents out on outings and appointments. But when they identified that the mother was a severe fall risk and had already had multiple falls, they then required, and it might have been a policy, I don't know, that they required her to have one-on-one care, not just short drop-in visits and checks. She was not going to be meeting the criteria anytime soon because of these falls. And that's why it's important to ask these questions about care and what they offer and what the process is when a resident starts to require more and more care and more one-on-one assistance. As we mentioned already, a lot of these facilities do have staffing services available. Some have in-house home care companies, but quite a few of them do not. And then they leave it to the family to make a decision on what way to go. Now, one of the things that you should remember as well is who is going to be the right fit for these assisted living communities. Typically, it's a person that requires very minimal care. They don't require a lot of one-on-one assistance. They're not a severe fall risk. They're not suffering from acute dementia. It's somebody that's still fairly active but needs a little hand, just here and there, but does not require one-on-one safety and one-on-one observation. And this particular lady really did not meet the criteria for being in an assisted living facility, but they did try it, and her mother was a lot happier than when she was in the hospital and didn't end up having to go to rehab, thankfully. But they did not ask the right questions at the time, and the facility did not do them a good service about explaining what would be required and what would be within their criteria for their mom to be a good candidate to be in the facility if her falls continued and she continued to need one-on-one supervision. So make sure you do your homework and ask good questions. When researching assisted living facilities, doing a good evaluation on current residents, talk to current residents, speak to the director of nursing, to their facility manager, and try to find out what options are available if the care needs do increase. So the final option for senior living that we're going to look at isn't really just for senior living. It could be for a number of reasons. These are adult group homes. This is a little newer concept for aging in place. These are becoming more and more popular as people want to maintain the home feel without all the responsibilities of maintaining their own home. Instead of moving into a large scale campus like a large assisted living community or independent living community, they look at adult group home. Now, these are usually right in the privacy of a home, and the homes offer a lot of the same amenities but without the oversized price and scale. Their concept is similar to homes for adults with disabilities, as they look no different than a private residential home. In fact, you've probably driven past them without even knowing that they were there. To show the popularity that these private group homes are starting to have, let's take a look at Wisconsin, for example. In Wisconsin, almost half of the assisted living providers are adult family homes, but they offer only about 1 in 7 assisted living beds. And that's right from the AARP.org. In some states, they are even able to offer independent living and or assisted living without it having to be one or the other. This is a nice feature for someone who may move into one as an independent living resident and over time develop into needing more assisted living care without having to move or relocate. It allows them to continue living right where they are at. The pricing for this option of living hasn't been calculated or really studied the way assisted living and independent living has been, though they have more history to go by than these group homes do. There are some figures and examples, but again, not to the depth that the others provide. A long-term care insurance provider named Genworth out of Virginia had provided a cost of care survey in 2019 on cost of care. What they showed was the national media charge for assisted living at nearly $50,000 a year, and for skilled or nursing homes are at around $90,000 a year to more than $100,000 a year annually, depending on whether it was a private room or a double room. As we mentioned, there's not a lot to compare and go by for these private group homes, but if you're just glancing at comparisons for the cost, the fees are less than traditional assisted living or skilled nursing homes. In California, where the cost of living is amongst the highest in the nation, only to be outdone by Hawaii and DC, the average cost for a 6-bedroom home is $36,000 for a shared bedroom and anywhere between $48,000 to $84,000 for a private room. Genworth had estimated the cost of care in California for assisted living to be at around $54,000 and $105,000 to $128,000 for a nursing home. If we go back to our earlier figures comparing costs of independent living and assisted living, remember location and state matters as well as the facility you choose. However, you can still expect to pay less than assisted living and independent living in nursing homes because of a couple of main factors. Less amenities. The other options are larger and therefore have more amenities and available spaces and activities. And they offer things like an on-site beauty parlor or barbershop, a movie room. Some even have small bowling alleys and indoor and outdoor pools, things like that, which help bring the cost down. Some of the larger facilities offer specialty wings, like we were talking about, such as a memory care unit or on-site rehab facilities. The convenience and ability to offer specialized care will increase their costs and, as a result, keep the cost of the group home option more affordable. And the adult group home option can also accept long-term care insurance, the aid and attendance benefit if the resident qualifies. One of the qualifications is that they or their spouse served during active recognized United States war. And finally, if the home participates in Medicaid and the state and individual participates and qualifies for the waiver. There are, however, some good advantages to this option. So let's go through them now. The care is more personalized with the ability for continuity of care, smaller census, meaning smaller number of residents, which allows for more personable and attentive care. As we were just saying about the care, there is a smaller staff to client ratio. Meals. The meals can oftentimes be catered towards the individual's likes and dislikes of the resident. This is something that can often get overlooked in the larger facilities. The menu is typically pre-made, and there can be some options, but if someone really has a taste for something that is a lifelong favorite, there's no guarantee that the larger facilities will be able to make it or would make it. Home, sweet, almost home. This is something we often hear from families and those we care for. They want to stay in their own home for as long as possible, if for no other reason, just to feel like they're in home. Now, they are small and they are typically in a home setting, and the person doesn't feel like another number. They get that personalization and that attention that oftentimes can be overlooked in the larger facilities. And the costs, as we have been discussing, the cost associated with this option is generally quite a bit less and more affordable than the larger living options. However, remember, there is usually a trade-off with there not being as many services or extracurriculars as well. Now that we discuss some of the advantages, let's look at some of the disadvantages. We just mentioned this one, and that is the size. The environment is smaller, and for many, that is one of the factors when choosing this style of living. However, it can also mean less privacy too. Another advantage that can also be viewed as a disadvantage is that there will be less activities or on-site amenities. The advantage, as we previously said, allows for the cost to be lower, but the disadvantage is if you wanted to do something or go to the salon or some other essential that the larger facilities have and offer on-site, in this setting you would most likely have to leave and go out to the service or activity you were wanting. Staff. Now, depending on the reason, the staff can be a big disadvantage. Oftentimes, the assisted living facilities have on-site RNs to help when a medical need or question comes up. In this setting, it is highly unlikely that there is an RN on site at all. I do need to point out that I know of several of these adult group homes, and they are all owned by RNs, and most of them are there daily. If this presents concerns for you, or if you are interested in learning more or exploring this as a potential option, I would ask these questions, and even when speaking with assisted living or any of the potential senior living options, make sure you know and understand exactly what each of them provide and what they do not provide. This has been repeated a few times through this video and through this podcast, but it's that important. Make sure you have a clear understanding about what they do and what they do not provide. These are the main senior living options. As a home care company, we have cared for and helped clients in each of these settings. Each of them have their pros and each of them have their cons. If you are looking to downsize and your loved one is fairly healthy, these are all good options depending on what your loved one and you are looking for. If you're looking for the best option, just for care and one-on-one help for them to avoid falling, and they no longer can perform their personal care, they need more help with meals and taking their medications and needs along those lines, I would also encourage you to explore professional home care services as well. The home care services can help for as little or as long as you need, and most providers will only come when you need them, whether it's 1 day a week or 1 day a month to help. It's a nice option to explore because it's flexible. You're not moving into a whole new environment if it's not necessary. And it can also help out while you're exploring and deciding on what the long-term decisions are going to be. And finding care and starting care is fairly quick and easy when compared to moving and packing. There are many good living options and care available for families, and they all want the same thing, and that's to make sure your loved one is cared for and safe. The hardest part is finding the option that is right for you. We hope that this episode has helped answer questions that you may have, and if you know someone that might be going through this very thing right now and this episode can help them, please share it with them. We want to help however we can. We're here for you and for our listeners. Thank you so much for joining us here at All Home Care Matters. Please remember to visit us on our website, allhomecarematters.com. There is a secure, private, fillable form there if you have show ideas, questions, or suggestions or feedback. All forms are read and responded to. Make sure to join us next time on All Home Care Matters as we discuss what are ADLs, activities of daily living. Thank you so much and have a great day.
Thank you for joining us today. We look forward to you joining us again on another episode of Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.